Thanks for staying with us. As diphtheria cases continue to surge, 19 states have been urged to consider instituting compulsory face covering requirements to slow down the progress of diphtheria outbreak. Health agencies made this recommendation at an inaugural Diphtheria Emergency Task Force team briefing in Abuja. Health correspondent Kemi Balogun has details.
Since the confirmation of the re-emergence of diphtheria in Nigeria in December 2022, Nigeria's health agencies swung into action to curb further spread of the disease. The ongoing outbreak is affecting states like Kano, Yobe, Borno, Katsina, Kaduna and Bauchi. Kano remains the epicenter of the outbreak, bearing the brunt of more than 84% out of the 97% reported cases. The concern among these health agencies who make up the National Emergency Task Force team on diphtheria is the risk posed by the large number of the unvaccinated or partially vaccinated who make up more than 64% of all recorded cases.
The federal government recognizes the power of vaccines in safeguarding public health, and our response to this outbreak centers around the belief that vaccination is our most formidable weapon. We have two vaccines at our disposal: the pentavalent vaccine administered to children aged 6 to 4 years, and the tetanus diphtheria TD vaccine provided to children above 4 years to 14 years.
Currently, 14 laboratories that we've optimized in the network to be able to do basic diagnosis of diphtheria. What we expect is that if you've got symptoms that are suggestive of diphtheria, you go to, in those states, you go to the treatment center to be investigated.
The outbreak is affecting children between 1 to 14 years, which is actually, again, a big concern, and these are the school-going age. Our recent assessment is WHO. We still place diphtheria as highly infectious disease and as a cause of concern from our side, hence the reason why we're also mobilizing more resources to make sure that this outbreak is controlled.
So far, Nigeria has recorded 13,204 suspected cases, out of which 8,404 have been confirmed cases across 114 local government areas in 19 states, including the FCT. The task force is now urging state governments to consider reintroducing the use of compulsory face covering, especially in states with a high burden.
By so doing, we can add another intervention to slow the progress of this outbreak, particularly in states like Kano.
The National Emergency Task Team was set up last month by the Coordinating Minister of Health and Social Welfare to enable a higher level of coordination of the diphtheria outbreak response efforts. Kemi Balogun, TVC News, Abuja.
For more on diphtheria outbreak in Nigeria, we have Vice President, Medical Initiative for Abuja, Dr. Agbo Ebuta. He joins us on the news this hour. Thank you so much for joining us on the news. Knowing that this is a highly contagious bacterial infection that can be fatal without treatment, what's your assessment of Nigeria's response to the rise in cases of diphtheria in the past week?
Well, diphtheria, we've heard the headlines and all of that. Nigerian response so far has been, it's worth recommending because to a large extent, they have been able to set up a task force consisting of the Center for Disease Control and the Primary Healthcare Development Agency. This is basically because you need to be monitoring the progress of the infection in the population, and you also have to put in place response, recovery, and mitigative measures. The major problem why we have this situation in our hands, at the center of it all, is because of the low vaccination coverage. Totally in Nigeria, percentage-wise, we are looking about 57% coverage, meaning that 43% of those who should have been vaccinated against diphtheria were not vaccinated. These people are susceptible, and they have accounted for most of the people affected. So we need to match diphtheria. We need to match effort for effort. We need to up our vaccination numbers. And the minimum vaccination percentage we require in all of these areas is as much as 80 to 85%. That is what will give us what you call herd immunity. So in areas like Kano, in Kaduna, in Katsina, in Borno, in Yobe, in Bauchi, which have accounted for 98% of the cases suspected and confirmed currently, we need to drive up the numbers as soon as possible. In addition to driving up the numbers, which will protect the community, we need to be able to provide information to healthcare workers on how to respond, how to treat, how to determine, how to make diagnoses, and then to provide the necessary consumables in terms of medications that are required. A very essential commodity, a consumable that should be provided, and I am aware that the task force is working on that and has deployed some of that, is what you call the diphtheria antitoxin, which is required to prevent the life-threatening complications of diphtheria. Because diphtheria is not simply about the upper respiratory obstruction. It can also cause kidney failure, heart failure, and permanent damage to nerves. And what will mitigate that is the diphtheria antitoxin. And the government, I hear, is making efforts. So all we need to, on the other hand, the populace would basically need to support government. Traditional institutions would need to talk to their people. Religious institutions will also need to talk to their people to reduce vaccine hesitancy, which is a major problem.
Doctor, I was going to ask you that in the past week we saw about 7,200 cases. Any reason why we see these increased cases in Kano, Yobe, Katsina, and other northern states? Any particular reason that we should look out for?
Yes, in these regions, in these states, vaccination uptake is very low. Overcrowding is very common. Access to healthcare in some of the local governments are also very challenged. And apart from that, close interaction, the absence of physical distancing, which is a key factor in reduction of aerosol transmission, aerodroplet transmission, borne disease transmission is also a challenge. So, and also we've also noticed that in the last couple of weeks, children have gone back to school, and these are the population that are mostly affected. They play very closely with each other, and they don't know what you call cough etiquettes, which is a measure that you can use to mitigate this transmission. Mm-hmm. So the numbers would keep going up, except we match it. And in matching it, we need to up-regulate vaccination. And the new position of the federal government, which was clearly stated in the task force bulletin yesterday, was that we are encouraging state governments to reinstitute the use of face masks, physical distancing, and high level of personal hygiene, like hand washing, which will reduce the transmission. I mean, this is aerodroplet transmission. It's just like COVID transmission. So those same measures, non-pharmacological measures that we instituted, they will go a long way in mitigating transmission significantly. Health education is critical, and we cannot fold our hands any longer.
Vice President, Medical Initiative for Africa, Dr. Agbo Ebuta, thank you so much for enlightening us on the outbreak of diphtheria in Nigeria. Thank you for joining us on the news. Well, the Katsina State Ministry of Health has flagged up the fourth outer distribution of anti-malaria therapeutic drugs to health facilities in the state. Katsina State is in the last 3 years has vigorously taken on the fight to end the scourge of malaria through curative measures to reduce modalities linked to malaria. Abdulatif Yusuf reports.
Over the years, malaria in Katsina State has remained endemic with all year-round transmission. A prevalence rate of over 27% has been recorded in the state, thereby making Katsina 17th in the rank of most affected states in Nigeria.
75 or prevalence is about 75 to 80% of the general population, but more are the children under the age of 5 years, and also children and pregnant women. But also the invention of the strategy seasonal malaria chemo prevention. You can see now the trend and also the prevalence of malaria within the age of under 5 is diminishing, because it's promising the drug is, the strategy also is very impactful. We are looking at ways on how we can be able to sustain this kind of an innovative strategy, because it's really very effective and it's also evidence-based.
Katsina State is now recording a lot of successes in its war on malaria through a regular supply of seasonal malaria chemoprevention drugs and media enlightenment campaigns. But there is need to penetrate hard-to-reach areas of the state through more campaigns.
Our strategy is that it is going to be house to house, door to door, so that nobody will be excluded from benefiting from the package of this preventive measure. You should know that we have envisaged increase in rainfall over a period of time based on the NIMET prediction, and we know these are peak periods when this type of infection escalates. So we are trying to be preventive rather than curative, and this is what the state government is doing. It has purchased drugs worth over 90 million naira. And
the implementation of the seasonal malaria chemoprevention in Katsina State is intended to reduce mortality in children under 5 living in areas with seasonal malaria. It is also necessary to sustain the successes recorded through this effort by strengthening health system at state and national levels for a better and healthier society. Abdul Latif Yusuf, TVC News, Katsina.
TVC News at 1. We'll take a moment and then return with more stories after the break. Just stay with us.
Things in life, making great music is a process. And a key part of that is the right data, and the data that helps you understand what needs to be done and how to do it, and what sound will connect with listeners.
No, bring it up, bring it up. I know everybody too.
Whatever aspect of life you're into, enjoy the journey. 9 Mobile's got you covered.
Dial *301# now.
9 Mobile.
When life is a little harder, we are here to lighten the load. Sedap Supreme Noodles is here for you.
Because only fine ingredients go into Sedap Supreme Chicken Essence to give it that truly delicious chicken taste. Sedap Supreme Tasty Chicken Noodles, capturing the supreme tasty chicken goodness. Come and taste the difference of Nigeria's real chicken essence noodles. Be Supreme Nigeria.
Thanks for staying with us. Kaduna State Governor Uba Sani has kick-started the distribution of essential supplies to the needy. The move is to support vulnerable families and communities across the state with a promise to reach 210,000 households spread across 23 local government councils. Lupe Asum has details.
Hardship partly caused by the removal of fuel subsidy. Kaduna State government is standing together to help over 1 million of its citizens find stability through these upcoming palliatives. These trucks laden with 43,000 bags of rice, each weighing 50 kg, are ready to embark on a journey to reach every corner of the state's 23 local councils, bringing sustenance and comfort. The governor says 1,935 million naira was swiftly put to work, securing the 43,000 bags of rice that are now on their way to the communities of the vulnerable.
So we're targeting over 200,000 households, and the beneficiaries will be about 1 million. We targeted the vulnerable, the poor and the underserved within our society, people that are in IDP camps, the widows, as well as people with disability.
The leaders of the labor union echoed their solidarity with the state government, expressing their determination to ensure these vital supplies reach the hands they were meant for.
We are so compassionate to consider the underserved, the less privileged, those people that needed this commodity the most. And after this one, God willing, with the permission of His Excellency, another round of another palliative, as he has rightly mentioned, will be going to our constituency, the workers and other citizens of the state.
Governor Sani is assuring workers and small business owners that more support is on the horizon to ease their burdens.
We are trying to also target micro, small and medium businesses, also to purchase some buses to ease transportation for our teaming workers. We also want to resuscitate our old locomotive trains that will ease transportation, looking at the route from Zaria to Kaduna to Savantasha to Kapancha.
This initiative showcases the effort of the Kaduna State government to stand with its people during these challenging times, providing hope and support in the face of economic shifts. Lupe Asom, TVC News, Kaduna.
Well, let's go to Abia State now, where a group known as the Abia Youths for Good Governance says it is shocked by a press conference, which is organized by another group known as Abia Youth Interest Group. The group had alleged that the governor of Abia State, Alex Otti, is using Abia funds to sponsor Peter Obi's presidential litigation. The group said that Abia State was looted and plunged into bankruptcy by the previous PDP government. Hence, Governor Otti, a knowledgeable economist and notable financial manager, could not have attempted to use the scarce Abia resources to fund a presidential election litigation. Well, the group also said they will no longer sit and watch politicians attempt to connive with enemies of the state and outside forces to stoke the embers of hate, violence and destruction geared towards the present administration.
The Abia Youth Interest Group's allegation against Governor Alex Otti is false and malicious. They allege that the governor of Abia State, His Excellency Dr. Alex, is using Abia funds to sponsor Mr. Peter Obi's presidential litigation. We feel constrained to speak and disabuse the minds of unsuspecting members of the public by stating the following. Governor Otti, a knowledgeable economist and notable financial manager, could not have attempted to use the scarce resources of Abia State to fund the presidential election litigation.
22 public primary and secondary schools in Ifelodun local government area of Lagos State are beneficiaries of free educational materials. The donor, the council boss, Olufemi Okeowo, says it is part of his annual back-to-school program for indigents in the community. Abimbola Agbebi has details in this report. After this report, we'll have business news with Frank Omalape.
The excitement that greeted the arrival of educational materials into the schools says it all. More than 9,000 indigent children in the Ifelodun area of Lagos received educational support to aid learning in the new academic session. The project is an annual gesture targeted at the vulnerable within the community.
By providing bags, uniforms, shoes, and the necessary writing materials, what is left? So they will be able to go to school.
I've visited all the schools and I noticed that most of the students, the pupils, they're wearing tattered clothes, torn clothes, and I felt really very bad. I was, in tears to see that. Then we decided to kit 10,000 pupils. Precisely 9,794 pupils in Ifelodun to kit them with the necessary materials they need for, to create a conducive situation for them to take in their education. They are our tomorrow. They are our children. It's just that the parents are a little bit incapacitated. So that's why we have the government to support, the needy, to make things go well for every one of us.
Artisans and traders also got a sum of 50,000 naira free cash to support their businesses.
Thank you very much. I'm very grateful. I don't know how to emphasize his ways. I don't know how to talk. I don't know how to... I give God the glory in Jesus' name. There's no money, there's no anything. But today I'm happy. If I put watermelon, put pineapple, put orange and other things, God will answer my prayer.
I will advise them to use it properly. They are petty traders. It's enough for them as working capital to get their business done. So I will advise them that they should use it very well so that they can prosper.
50 people, 50,000 for 50 different people per month for 24 months. We believe that at least over 2,000 people will touch their lives.
They assured residents of the area of more people-oriented projects in coming days. Abimbola Abibi, TVC News, Lagos.